Hi, my name is Michael Benefield. This is my assessment of the heart and neck vessels. This is for Albany State University BSN program. So the first thing we want to do is we want to make sure that we have our head of the bed elevated at 30 degrees, and we want to examine the neck vessels themselves. We're inspecting each side of the neck for symmetry in a suprasternal node starting at the suprasternal notch. We want to inspect the jugular veins and inspect for the presentation of the jugular veins. Following that, we're going to move on to estimating the jugular venous pressure, and that's something we'd do if it was necessary for the patient. We want to move on down and we want to inspect our precordium, and we're noting any abnormalities, any pulsations, inspecting it. Okay. We're going to follow up with palpating at the apical impulse, and we're noting the location of that also. Then we want to palpate the precordium for thrill, for any vibration that may be felt. And the next thing is we're going to listen for the apical rate and the apical rhythm. So listening for the apical rate. And rhythm, and then we're going to make a note of that. We also want to move on to listening to first and second heart sounds on this patient. And then after we're done with that, we're going to use the bell to listen for any extra heart sounds, noting any gallop, any murmurs, any clicks, any rubs. So using the bell and stethoscope, we'll turn it over and we'll do the same thing again. Following that, we want to get our patient to lie on the left side. And so we have the patient turned over to their left side over here. And as they're turned over, that gets the apex of the heart closer to the actual rib cage itself. And so as they were turned over, we would again listen to their heart, noting any abnormalities, any murmurs, any clicks. And that's the conclusion of the assessment of the neck and heart.